The first section of the dental force analysis is the force distribution that is directly correlated to the TScan habitual force pattern scan that we've done on our patient. As we fill out this force distribution and force balance area, we're going to be looking for 4 separate red flags down at the bottom of our dental force analysis form. The first section on the force distribution form is we want to look at the kite tails, which are officially called the center of force trajectory on the scan itself. We usually put our cursor, our time cursor, into the last squeeze or the last close, harden hold at about maximum force. And then that will give us a pattern of center of force trajectories that will represent the patient's normal force pattern as they go through their close, harden hold, their 3 chomps, and their final close, harden hold. This force pattern on here represents for us the center of all the forces as they're added up in the mouth. The computer takes all of the forces around the arch, adds them up, and puts them into a position relative to each other as if it were the patient. I usually think about this as if it was a denture patient. And if a denture patient, if the center of their force is way off to the side, outside of the target zone, that denture will be loose and rocking around. Our patient doesn't have a denture, but that force distribution, which is off target, will send a signal to the headache center in the brain, which then is an abnormal feedback loop signaling dysfunction in this patient. In this particular case, we're going to look at the center of force trajectory and we're going to see, do these kite tails, are they on target or off target? And we're going to definitely see in this situation that they do not fall within the white target zone. So we're going to classify these as off target forces. And we will then check off the red flag down at the bottom of our dental force analysis for off target kite tails. We usually visually also draw this center of force kite tail pattern on the form so that we have a visual representation of what we have on the computer screen. The next thing that we look at is, are these kite tails long or short? In other words, if we were to move these center of force trajectory tails into the target zone, would they fit? And the answer here obviously is no, they would not, and we would then consider these to be long center of force trajectories or long kite tails. In that case, we will also come to our form and we will check off that this patient also has long center of force trajectories, and that's going to be replicated again by what we've drawn in on the graph at the top of the form. If we need a frame of reference for whether or not we have long kite tails and whether or not they are in the target zone, we have to do is just look at the form itself, and we have a dark blue barbell inside the target zone, and that dark blue barbell represents a normal trajectory being short and fitting inside the target zone. So we can refer this patient's kite tails, which are way posterior and definitely outside the target and way too long, and we compare that with what would be normal, and it's easy for us to see that these are definitely red flags for this patient. The next area of the TScan that we need to put onto our dental force analysis form is our left-right force balance. On this, we are generally looking for on the screen to see what the numbers are left and right. And if we look at the patient's graph all the way across the bottom, we can see that the green line is above the red line on every one of these squeezes. That means that the green side is always higher than the red side. In other words, the forces are too high on the left compared to the right. How much too high is a red flag for us? Usually we would consider it to be a red flag if this is 55-45 or worse. In other words, is there more than 10% difference between these two? This is 53-47. 53-47 is pretty close to 50-50. And so in this particular patient, we will not check off the left-right force balance red flag for them, and we will leave that blank. The next thing that we're going to look at is the force distribution around the arch. And on your dental force analysis form, we have put some guidelines inside each tooth to represent the percentage of force that we would expect to see on these teeth. Now, these are just a guideline. However, they give us an idea of how close the patient is to what's normal. Ideally, if our force on any one tooth is more than 5% higher or 5% lower than normal, then we would consider that to be an abnormal force on that tooth. As we look around our patient's arch here, we're in the molar areas, we're looking at 10 to 13%, and we'll see that tooth number 15 is 14.5, which is very close to normal, but tooth number 14 is 23.8%. We're going to actually put that down here as 23.8% or 24%, knowing that that is definitely more than 5% higher than 13% on that patient. Then we're going to look at the premolars, which in this case are 4 and 4, and that is just a little bit less than the 6 we would expect to see. We see about 5 on tooth number 11, which is pretty close to what we would normally see. And in the front, we have 1.5 on the laterals and 0.3 on the centrals. I would normally expect to see some force on the central incisors, and in this particular case, I'm just going to put an X on the central incisors to know that they have too little force. So my force distribution onto the front teeth is less than normal, and my force distribution in the posterior is greater than normal. We'll do the same thing for the other side. Both of the molars on this patient on the other side are abnormal. It's 18% on number 3, 19% on number 2. Those are both too high according to what a normal force distribution would be. As we look over this, we can see that we just have a few teeth here and there with an abnormal force distribution. If we want a graphical representation of that for the patient, we can just look at the three-dimensional graph over on the side, and we can see that these areas that are too high on the force distribution that we transfer to our form also are represented graphically as what we call towers of force. When we have a few towers of force and there are other teeth in here that have very little force, we know that the forces are not well distributed around the arch. When the forces within the mouth are not well distributed, that always feeds back to abnormal sensory motor function. So in a patient that has any of these 4 red flags, we're going to know that patient's sensory motor system will be functioning abnormally, what we call sensory motor dysfunction or dentomandibular sensory motor dysfunction. This dysfunction always locks in patients into abnormal chewing patterns and often into abnormal pain patterns.